Here's what other women are not telling you about having a breast leak at 7 months during pregnancy or before a pregnancy, before a delivery. You're already having your colostrum flow before your delivery, and you are head posted on why you are having a breast milk flow when the baby is not here yet. Here's what your sisters are not telling you, and here's what experts have to say about having a breast milk flow even before the baby gets here. Hi guys, welcome to another episode of Pregnancy Chronicles with your feature midwife. On today's episode, we'll be talking about what it means to have a breast milk flow even before the baby gets here. Is it normal? What you should take note of, what you should look out for, and what experts have to say about breast milk flow, most especially your colostrum, even before the baby gets here. First, let's dive in. Before we get into a topic of today, let's first understand what colostrum is. Colostrum is a highly nutritious breast milk which is slightly yellowish in color, which is, we call it the first breast milk or the golden milk, which is the first breast milk that comes out of a woman, and we call it colostrum or the golden milk. Here's a twist. Some women have their golden milk flow even before the baby gets here. Over 6 months and you're already seeing breast milk flow before the baby even gets here. And sometimes it gets a little uncomfortable. You have breast milk flow. You have to be on breast parts as early as 7 months before the baby gets here. Sometimes this breast milk flow tends to sometimes this breast milk flow tends to stop, come back later. Sometimes it even continues till your baby gets here and the breast milk just keeps flowing. This is very normal. It is very normal, and for you to have, we say you are having a breast milk letdown as early as 7 months. Breast milk letdown is very common as in the early third trimester of pregnancy. What happens that causes this breast milk letdown is once you're pregnant, you have high levels of hormones like the progesterone, and you also have there's as the early third trimester, the breast milk hormone we call the prolactin is the brain is getting it ready for letdown once the baby is out. So what happens is during your late third trimester of pregnancy, there can be a hormonal surge. So when there is a hormonal surge, this breast milk hormone gives a wrong signal to release when it's not yet time. So when there is a when there is a hormonal surge, there's then high levels of that breast milk hormone, which is a prolactin. Once it goes up, then there is a letdown. So when there is a letdown, the woman will then now see as a breast milk discharge, and she may as well see her golden milk flow coming out when the baby is not here. This is not to leave you in stress or anxiety, but you want to seek counsel from your healthcare provider, your nurse, or your midwives to be sure this is just a normal breast milk flow due to a hormonal surge, and not for call of concern when you see your breast is having like an orange, it has pores, or you have painful breasts following your breast milk flow, as well as the discharge comes with blood. If you see these signs, you want to consult your healthcare provider to be sure that there are no complications included with your breast milk flow when the baby is not yet here. And having this breast milk flow doesn't necessarily mean this will send you into an early labor. No, this may not necessarily send you into an early labor. Here are tips you just need to know to follow to ensure you are still healthy, you are kept clean, and you are emotionally and psychologically free of stress from the breast milk letdown. You want to get your breast parts you change regularly as much as 4 to 6 hours per day to be able to reduce you of the breast milk discharge, to keep you clean and dry. It will also help to keep you looking smelling nice and clean, because mind you, breast milk flow comes with a lot sometimes, so the breast milk part comes a lot more handy. And you can start with your breastfeeding bras to help you change your pads as seamlessly as possible. So yes, if you experience breast milk flow or discharge as early as your third trimester or before your baby gets here, you can want to get to your healthcare provider, talk to your midwife to be sure this is just a breast milk flow due to hormonal imbalance as well as hormonal. I hope you learned a lot from this content and you can say like a pro. So let me know where you're watching this video from and how you'll be using these tips to give us a thumbs up and share this video